Hi, welcome to my channel. If you're new here, my name is Judith. I am a Kenyan who lives in Norway, and I have been living in Norway for the last 7 years, and I have lived in Sweden as well for 2 years. So if you're new here and you have not subscribed, subscribe. That's how you pay me for this information, and also give this video a thumbs up to reach many people. So, yes, some of you have been asking me to talk about caregiving jobs. Yeah, I know many people are interested in this topic. And as somebody who has worked as a nurse assistant, I have knowledge to talk about it. Yes. So when I was done with learning Norwegian language up to B1 level, I applied for a nursing assistant job, which I got. If you're in Norway, language is required to work at the institutions because the people who live there do not speak English or any other language but Norwegian. So you will have to learn Norwegian language up to B1 level because it's a requirement. Once you're done with Norwegian language B1, you can apply on the municipality website. They are normally looking for workers. Or if you have no idea how to go about it, you can go to NAV. That is if you live in Norway, and NAV will help you through how you can get praxis at the institutions. So after I was done with learning language, I applied and I started working as a healthcare assistant and professional because I had not taken any course or I had not been to any school. And as an unprofessional, your salary is not the same with somebody who has been to school. So nursing assistant, the ones who have been to school are called health care workers. In Norwegian, they are called helsefagarbeider. They go to school. For you to be a helsefagarbeider, you have to go to school, and the school is the 2 year courses that does not need bachelor degrees are offered in a place called Vidregoende School. This is upper high school. They offer vocational courses, and here you learn for 2 years. After 2 years, you take internship also for 2 years. So what do they learn at the school? They learn different subjects which maybe you have learned previously in your country. Like we were learning mathematics, English, science, history, samfunnskunnskap, and the language, the yrkesfag is the profession subjects. And while doing this, you're also going to do practice in different places. Like, for example, when I was there, I went for practice to daycare. Here is where they leave small children from 8 months until the year they turn 6, because they start school the year they turn 6. So you go there and you also try out and see if you like this kind of job. Also, you try out at the school. It's called ASAFO. You can work there as a helsefagarbeider. Also, you try at the institutions. There are 4 different types of institution. There is the elderly home where they live in the institution. Then there is one rehabilitation center. Then there is Yametjanester. This one is home services where you bring medicine and help the patient with the day-to-day life and things they need. Also, then there is a Sikhism center where mostly the dements and Sikhism patients live live in. So you try out in these different institutions and to see what you like. Then, so when you move to second year, you choose exactly what you like. And I can say trying to work before I could go to school really helped me to decide if I wanted this job, because Healthcare working is not for everybody. It's a calling job for you to help somebody who is vulnerable, somebody who needs you, probably depends on your help, probably 100%. You must really it must really come from your heart to help somebody like this. So for you to be a health nursing assistant or healthcare worker, you must be patient, very patient. You must have good listening qualities, because you have somebody who maybe have difficulty explaining themselves because of the disease they might be having, or because of old age. Also, you must have love in your heart for you to care for somebody who is really in need of being cared for. So when I started working there, I was being paid 194 Norwegian crowns. That will be around 200 and 2000, maybe 2000 krona. That was 3 years ago. And here in Norway, your salary increases by years. As you work, it increases. So my salary has increased. Now it is around 210 Norwegian krona, and it is low according to Norwegian salary, because I am still unprofessional. I have been in school, so I went to school for 2 years and I was done. Instead of taking internship, I have taken 1 year to get general competency for going on higher level. And so if you're done studying 2 years in school, you will apply for internship. Internship, you apply at the municipalities, and there you can get interview, and sometimes it might be competitive, but Norway needs workers, so you will get a job if you have passed all the subjects and you are competent. And then you will do the internship in the various institutions, four of them, and your salary, they start you with a little salary in the beginning, but it increases as higher you go, until the last year it might be 80%, if I'm not wrong. Yeah. And when you're done with that, there's an examination at the end. There are two types of exam. First exam, you get a case of probably two patients, and you write a case about this patient, maybe the diseases they have, how to take care of them from when you start the job in the morning until you are done. You make activity, breakfast, the food they eat, which kind of disease they have. So you will have to write all of this. Then the next day you have two sensors who comes with you to the room, to you show them how to take care of this patient from the start until the end. And after you are done with that, you will have a 20 minutes meeting with them. They will ask you questions, and then you will answer. And also, this is the time you can explain where the things went wrong, what you would have done better, and what you did wrong. Then after that, if you have passed, you will be qualified as a healthcare worker in Norway, but you must send your papers to health website, Norway health sector, to authorize that you are an healthcare worker, because you must get authorization. Also, to work in a healthcare facility, or as a nurse assistant, you must get approved from the police. Yeah, because they do not want criminals to work with vulnerable people. So after that, you will start working, and as a helsefagard by the healthcare worker, you can work in hospitals, healthcare services in municipalities such as nursing homes, elderly care homes, home help services, occupational health services, in mental health care, in the school, and in health centers. So there are many places you can work. It's just you to choose. And also your salary will increase. Healthcare workers who have not worked yet, they will start your salary at the last time I checked, it was 245 Norwegian krona per hour, and this is 2,700 Kenya shillings. So this money might sound a lot to you, but don't forget you're spending it in Norway. And Norway is among top five countries, expensive countries in the world. So according to here in Norway, this money is quite low. So you work as where I'm working as a nursing assistant. We have three shifts. We have day shift, afternoon shift, and night shift. Day shift start at 7:30 in the morning until 3 o'clock, sometimes 3:30. Afternoon shift starts from 3 o'clock until 10 o'clock, sometimes 10:30. And then night shift start at 10 o'clock until 8 o'clock in the morning the next day. So night shift has 10 hours, and normal afternoon and day shift has 7 hours and a half, sometimes 7 hours. And sometimes you might work in weekends. If your contract indicates that you will be working in weekends, you might work like I work every third weekend. So that is part of your contract. But if you work, like sometimes I work as a substitute where I get called to fill the empty shift, then I get double paid for those one. Also, you get double paid in the late afternoon, which are not normal working hours. Also, from 8 o'clock to 10 is referred as night shift. You get extra paid. And night shift, they normally get a lot of extra paid. People who work in night shift, they make good money. But night shift, they do not take on professionals like me. You must be professional. You must be healthcare worker or a nurse to work night shift. So Norway does not take caregivers or nurse assistant from out of Europe. They take from neighboring countries, which is Sweden, Finland, or Denmark. They can work in Norway because they have similar languages, similar rules from the schools and what they have learned. And there are so many Swedish citizens who work here in Norway, especially they are being brought by the agencies. So if you live in Sweden and you'd like to make some money here in Norway and you have been working in healthcare, you can check on the agencies that bring people to Norway. And also, Norway take nurses from Eastern Europe. We have many of them, nurses from Romania, Ukraine, Poland, and they also come through the agencies, but they also have to learn the language, especially nurses. They have to learn the language. You have to be two level, and also they have to do the Norwegian health nursing program for some months to just integrate into nursing in Norway. So yes, that is healthcare giving jobs in Norway. And as for now, I'm studying for 1 year to get general education competency to go even further with my education. Thank you for being here. Let me know other topics you'd like me to talk about. If you like these videos, please subscribe. That is how you pay me back. Give this video a thumb to reach many people. Like, let's interact in the comment. If you are a health worker in Norway, write in the comment. Let me know if you work in Sweden, you want to work in Norway, you can get the agencies. Also, if you're in Kenya wondering how to come to Norway through healthcare working, there is no any agency that do that because Norway does not allow that unless you are here in Norway and you have a work permit, you have a residence permit, then you can work as a nursing assistant before you start school, but you must learn the language first. Thank you for watching. Let's meet on the next video, and thank you also so much for being here with me. I am so happy to be here. When the weather gets good, I will start showing you guys outside again. Thank you. Bye. See you on the next video.